Dr. Alla once again. So I want to give everyone a tour of the heart. A lot of my patients ask me, well, can you explain the heart to me? So I think we'll use the heart model and we'll have a little tour of basically everything that goes on with the heart. So this is a gigantic heart. It's not to size. The heart is about the size of your fist. They tell you, your heart's about the size of your own fist. So if you're smaller, it's a little smaller. But this is basically what the heart looks like. This is the right side of the heart. This is the right ventricle. This is the left ventricle, and I'll open it up in a second. This is your aorta, the red one on top, which is the final. Your left ventricle squeezes, all the blood goes to your aorta and to your brain through your carotids, and then down the rest of your body. The blue one here is called your pulmonary artery. This, when your right ventricle squeezes, all the blood goes to your lungs and then through the pulmonary veins, which are on the back here, drain into your left atrium, which is this top chamber. When that contracts, it goes down into your left ventricle, and then that goes out your aorta. The right side is this one here. The right atrium is where the blood all comes in from. It comes in from the superior vena cava, which brings in the blood from kind of like the top organs, your brain, your arms. That all drains into there. And then there's a bottom part here, which is the inferior vena cava, which brings the blood flow back up through your legs and the rest of your organs. Then that gets squeezed. The right atrium squeezes, puts the blood in the right ventricle, which goes, and then when that squeezes, goes up the pulmonary artery into your lungs. There's a lung on this side and a lung on this side. The heart kind of sits like this in your body. After the lungs oxygenate the blood, comes back in through the pulmonary veins into your left atrium. When that squeezes, forces blood down into your left ventricle, and I'll show you the inside in a second. And then when that squeezes, everything goes up into your aorta, to your brain, and then the rest of your organs down below in your body and your skin and your muscles. Now I'll take this apart a little bit. The aorta and pulmonary artery come off quite easily. You can see here the tricuspid valve, which when your right ventricle squeezes, forces the blood one way into your lungs, and behind it a little bit is the aortic valve, which when that squeezes, the blood goes one way into your aorta and down into the rest of your body. Taking this apart a little bit further, this is your right ventricle and your left ventricle. You see these white cords, we call these chordae tendineae. These hold the valve leaflets in place to not let them flap uncontrollably. When these start to deteriorate, or the valves do, that's when you get something called regurgitation. This is the tricuspid valve, which separates the right atrium, the top right chamber, from the bottom ventricle, which is the right ventricle. When this squeezes, that's what forces the blood up into your pulmonary and your lungs. Blood comes back through your pulmonary veins from your lungs into the left atrium. When that squeezes, blood goes through the mitral valve, and these are the cords for the mitral valve. The valve isn't shown here. It goes down into your left ventricle, and this squeezes. This is your strongest chamber. You see the musculature in the left ventricle is much, much stronger and thicker. When this squeezes, this forces all the blood out through the aortic valve and to the rest of your body. Now, regurgitation or leaky valves is when a valve, normally the valves close, the blood flows down from the top chamber, for example, down to the bottom chamber, and then they close. When these are loose and they don't close all the way, or they don't come together, if your heart is dilated and they don't come together all the way, a little bit of blood can ooze back into the top chambers, or if it's from the aorta or the pulmonary artery, it can ooze back down into the ventricles, and those can cause various disease states, shortness of breath. When it gets serious enough, we usually grade valves from trace to mild to moderate to severe. Severe, we wouldn't even be talking. You'd probably be hospitalized and extremely short of breath. But if it's mild or trace, we just kind of keep an eye on it. Once it gets to the moderate range is when we kind of like really need to keep an eye on it. We get ultrasounds and echoes quite frequently. We ask you about your symptoms quite a bit. This is called a papillary muscle. It connects to the cords. You usually have them on both sides. When the heart squeezes, the papillary muscle hangs on to the cords and helps the valves kind of open and close without breaking or loosening. Now, the heart has four basic motions. The first motion is the muscles coming together. The second one is this endocardium thickening. The endocardium thickens, which also helps force blood out. The next one is that the apex, the bottom of the heart, comes up towards the base of the heart. This part of the heart is called the base of the heart. This is the apex. It squeezes up towards it. And then the third one is like a wringing, almost like a twisting, like when you wring out a shirt to wring blood out, to wring wet water out of a shirt or a towel. It's a twisting kind of motion that also helps force blood out. So that's a tour of the heart. It's obviously a very complicated organ, but very, very essential. There's arteries on the outside that we check with cardiac caths. And then the blood vessels from those arteries go down into the muscles. That's how we look for blockages with cardiac caths or via stress test indirectly. But that's kind of what the heart looks like. This is a gigantic version of it, but it's awesome to illustrate this. Your heart is about the size of your fist. Hopefully this helps. Share this with all your friends.